Hi class. I just wanted to take the time to go over week 4 readings and assignments. So this week you will have chapter 10, Cognitive Behavioral Therapy for People with Addictions. This is a good review of CBT for addictions. This is a very evidence-based approach for people with substance use disorders. So it takes you through explaining, many of you do have a basic understanding of CBT by now. I know many of you have referenced this in some of your discussions thus far. So hopefully this chapter will be a review and give you a little bit more of an understanding of specifically how CBT is used for people with substance use disorders. I won't go too far into CBT itself, but I do want you to focus some of your attention on the section regarding the stages of change in the chapter. This is something that is used very regularly within substance use disorder treatment. In fact, the ASAM criteria for addiction references the stages of change in dimension 4. I'm not expecting you to understand the dimensions in ASAM, but this is something that is often used within residential treatment to assess an individual. So readiness to change is really important in terms of meeting people where they are in treatment, and it'll give you some ideas into how you might want to focus your treatment. For instance, the pre-contemplative stage of change, you might be using more motivational interviewing strategies. People in the pre-contemplative change usually are in some form of denial of their addictive nature. Whereas people who might be in the action stage of change, you might be able to use more specific CBT related skills. So cognitive restructuring or some behavior management strategies might be able to be used more so in the action stage of change. This is something that is useful for any kind of mental health condition, though it's specifically useful for substance use disorders because there is such a progression between state of denial through action. So then you do have, there is a handout here regarding addiction and the disease concept. You can reference, there's some links that you can click on to gather some more information. You'll see that a lot of the information this week is related to whether or not addiction is a disease. Within our videos here, there's some segments of this Pleasure Unwoven movie that's just questioning, this disease concept. Do we recognize addiction as a disease? Is it more of choice? It kind of goes back and forth in terms of, giving you information on either side. Is it a choice? Is it a disease similar to a medical disorder? Or is it something in between? So the goal is just to give you as much information as possible to kind of peruse so that you can develop some thoughts and ideas about this yourself. So then you'll see, moving into the discussion, you're going to be viewing these sections of the video. You can feel free to view the entire movie. You can probably find the rest of the clips on YouTube, but specifically the clips that are required for the course. Make sure to view all of those segments and the Bookman article from last week's Learning Resources. So you'll see here some thoughts on the disease concept, the disease model, some pros and cons of it. I think, many of the pros of looking at it from the standpoint of a disease is that the treatment of it is a little bit more clinical. I would say that people with substance use disorders, when they look at it as the disease, they can externalize it a little bit more versus internalize it, and that can help them tackle it a little bit more effectively. Though on the other side of things, looking at it as a disease can make people be viewed as more different and it can be stigmatized in that way, which can actually decrease the self-esteem. So again, just looking at it from both perspectives, I think there's question of which one is correct. We don't really know which one is correct right now. So that's the point of having discussions like this. So in terms of your initial posts, you're just going to be kind of reflecting on that, looking at it from a macro and micro perspective. How do we as social workers, for instance, promote policies that will improve the treatment of people with substance use disorders? And from a micro perspective, how can we encourage clients a little bit more and help them take responsibility to, have a healthy recovery? I think a lot of the arguments here are that, at minimum, addiction does start as a choice for many people, though, there is argument that it doesn't. I mean, there's many people with substance use disorders who their addiction starts with prescription medication. So regardless of all of that, there has to be some action by the individual with a substance use disorder to seek treatment and engage in treatment. So how can we promote that in people? How can we motivate them to do so? And then as usual, you're going to follow up with at least one classmate. Just try to add to their learning in some sort of way. This is a very opinion-based discussion, so I'm hoping you can gain multiple different perspectives and hear what your classmates have to say and learn from them, as well as add to their learning. So then moving on to the assignment. It's important to know that this assignment, the self-reflection assignment, is completely confidential. I'm the only one that's going to be viewing this. This is graded like a paper. It is very much focused on you exploring your own views of substance use disorders and addiction. I want you to try to be as honest as possible with yourself. We're really trying to explore your internal view of substance use disorders, any stigma that you may have adopted. This is something that I want you to, again, try to be as honest as possible with yourself. It can be very difficult to look at any kind of implicit bias that you might have or stigma that you've adopted, but it's also very important because the only way to reduce the negative consequences of things like countertransference is to be aware of it. So I think this is a very, very important reflection to go through. You'll see the directions right here. Some of these questions might be a little alarming to you because they probably don't feel very good. Looking at, terms like drug addicts, biases, are we paying too much money to, with incarceration and rehabilitation? Should they be locked up? I mean, these are things that the questions themselves are meant to kind of pull out some of those, negative thoughts that people might have about addiction. And, I'm not saying that you have to create some negativity in your mind regarding people with addiction, but I want you to try to really just be honest with your responses. There's no right or wrong answer. The point of this self-reflection is to pull out any potential for countertransference. So you're going to go through these particular questions and answer them as honestly as possible. And then in the process portion of it is when you're going to go into countertransference, go into how it might impact your work with people with substance use disorders. And then I want you to look into 2 scholarly sources related to countertransference. This can be related to countertransference for substance use disorders or not. We're just generally looking at countertransference, and referencing how this can contribute to your understanding. It can be something that's related to how you might manage countertransference, or it can just be generally theoretical related to countertransference. So that is what the requirement for the paper is. You do need to have APA formatting with in-text citations and a reference page. The reflection should be 5 to 6 double-spaced pages. So I want you to be thorough in terms of your reflections on these questions. And the paper is due by Sunday at 11:59 p.m. You can reference the rubric, which I'm not going to pull up here right now. Obviously, that's how I'm grading the paper, is based off of the rubric. I do hope that you can use headings to organize your paper so that we can make sure that you're thoroughly exploring all of the questions. As usual, if you have any questions about the paper or the assignments or the content, feel free to reach out to me, and I hope you all have a great week.